I'm Kathy Pritchard-Jones and I'm the Chief Medical Officer for London Cancer. Over the last 10 months we've been developing, in partnership, working with 14 trusts across North Central and North East London, how we're going to work together to provide and improve integrated cancer pathways for patients. The challenge in London is that we have some of the most expert people in cancer research and cancer care in the world, and yet despite this concentration of expertise in the capital, if you actually look at a population level, we're not delivering good outcomes for our patients. And more recently, we heard from the National Cancer Patient Experience Survey that cancer patients in London also feel that they don't have a particularly good experience of having to receive cancer care. So I think the solution here is that we have to get people to work together, think about the patient pathway, both about where the patients come from, could they have got them more efficiently into their part of the system, and where they're going to go next for the next part of their care. The first thing that we want staff to do is keep the patient that's in front of them as their major focus. This is around understanding what the cancer treatment means for that patient in their own individual life context, and who better to know that than the staff who are actually treating them in their hospital. However, we do want staff to think a bit more broadly about the route that the patient took to end up in their institution, and also where they may have to go next, and who else needs to know about what's happening with that patient whilst they're under their care. So we want staff to take responsibility for giving patients clearer and more complete information about their planned treatment and their options, and ensuring that information has been delivered on to the next step in the pathway ahead of the patient getting there, and that their GP and community support are kept up to date. There's going to be a lot more information about what an excellent pathway for each individual cancer should look like, and where the elements of that pathway are provided across the system. So I think the first thing that staff should be aware of is that they themselves will be more aware of the treatment options available for the patients under their care. The biggest benefit, I think, will be that patients will have a better chance of surviving their cancer. We aim to work with primary care and with the public to ensure patients present earlier for medical attention, that they're diagnosed more rapidly and efficiently, and that they are able to access the very best possible treatments that they need. I would like staff to understand that this is an enormous opportunity for us to be truly world-class in the care that we can deliver for our patients. I would urge them to get involved, put forward their ideas, and help us understand the needs of the patients in their part of the system.